It's October 10th, and this is the public hearing on the Uniform Prior Authorization Form. My name is Sebastian Arduengo, and I am an Assistant General Counsel for the Department of Financial Regulation. Under Title 18, the Department and the Department of Vermont Health Access are supposed to work collaboratively with the commercial payers to periodically update the Uniform Medical Prior Authorization Form. And as part of that process, we are conducting this public hearing to gather more input on the form. We've had 3 previous meetings on this form, and the department's hope is that both the Department of Vermont Health Access with respect to Medicaid and the commercial payers can deploy this form starting for plan year 2024, which for most plans is January 1st of 2024 and thereafter. So I'm going to walk everyone through the form and talk about some of the changes we made and why we made them, and then talk about some of the administrative issues that are related to the form insofar as things like branding and public posting to websites. So this is the last draft that everyone agreed to. And the big change from the previous prior authorization form is that every payer will now be able to have their own separate instruction form or instruction sheet for this form, which can direct for Medicaid, their beneficiaries, or for commercial insurers, their insureds, to other resources if for instance, there are if there's specific clinical information that needs to be directed somewhere for certain services, that those instructions can convey that information, and we can keep all of that clutter off of the form. It's also important to convey that the intent of this form is to be a general form that can be used to request a prior authorization for any medical service from any payer. So while payers can have other forms for specific services or have other methods to submit prior auth, like I know that the commercial payers all have electronic prior authorization vendors where providers can submit PAs electronically. This is supposed to be the lowest common denominator of requesting prior auths, if you will, where a provider or a patient could just fill this form out and fax it in, and that should be enough to get the prior authorization process started. In terms of the required information, the biggest change that we made was making the patient's gender identity an optional field. And the reasoning behind that is it's to the extent that gender identity information would be necessary to complete a prior auth. It's the collective opinions of DIVA and the commercial payers, that that information would be in the clinical record if it was necessary. So there's no need to um, have a patient spell out whatever they think their gender identity is in the context of this form. Um, we've also tried to simplify the referring and requesting provider information, at least to the extent that all that's really required is enough information for the payer to get in contact with the referring or rendering provider. And then we're also requesting information about the office contact or the person who's completing the form here. Typically, this will be someone at the requesting provider's practice, but sometimes it's not. So that's why we have that separate field for the person who's completing the form. With respect to required clinical information, which is really the heart of this form, we've rearranged a lot of the boxes for different services. And it's our hope that by doing, by arranging services this way, there's less of a distinction between a given service, whether it is for med surge or mental health. So that's why there's only a box for a medical admit, in that if it's an inpatient mental health admission, that will be clear from the clinical documentation, and there's no reason to muddy the waters with this form and have a separate box just for that. We also updated some of the boxes for place of service to add telehealth and audio only, since those services post-COVID are now sort of a core modality for treatment. So if the patient is requesting a prior auth for a telehealth service, we can account for that in this form. Finally, the rest of this form from proposed number of treatment days onward is the same as the previous form. The only additional box we've added is this check mark for additional clinical information. And this is so if the payer receives this form and sees this box has been checked and doesn't receive the clinical information with the form, then they'll know that there was an error in mailing or faxing, and they'll be able to get back in touch with the person who sent in the form to know to get all of the information needed to complete the prior auth. I want to emphasize that this is not a perfect form that will work perfectly for all services. This is just a baseline general form that can get the process started for any medical service without the patient needing to figure out which of a dozen different forms they should use. So That concludes my overview of the new Uniform Medical Prior Authorization form. And now I just want to discuss a couple of the administrative details. Um, First, the department anticipates that we will maintain a copy of this form with DFR branding that will be on the DFR website, which could be used for any of the commercial payers and for Medicaid. However, we have no issue with either Medicaid or the commercial payers having a branded version of this form. So, for instance, the Medicaid Uniform Medical Prior Auth form would have the Department of Vermont Health Access logo. MVPs would say MVP on it. It would be the same form, but we have no objection to branding. Um, Secondly, it's our expectation that all of the commercial payers and Medicaid will post this form and any relevant instructions on their websites. And we anticipate that when we go live with this form, that in addition to having a copy of the DFR version of this form on the DFR website, we'll also have links to the Diva and commercial payer websites and their copies of this form and any relevant instructions. So with the overview of the form and the administrative details out of the way, I would be open to taking questions from the three of you that attended this meeting. No one is in here with me in person, which I think is probably for the best since we're in a conference room that seats 8 people. So, are there any questions from Claire or Tara or Marlene?
I don't think I have any questions. This is Claire.
The only thing I wondered is, are you anticipating with DIVA and commercial payers changes in requirements for prior authorization? Like it's been a long time since we've needed prior auths for any
Yep.
for any mental health outpatient services. But I came across a policy proposal for testing that looked like lots of prior auth hoops. And I'm just wondering if you're aware of that.
Yes, let me answer your first question, and then I'll follow up on the additional hoops for prior auth. So this form would not change any of the substantive prior auth requirements. It is only intended to be like a one-stop shop to start a prior auth. Insofar as the commercial payers adding new prior auth requirements.
Yeah.
We, the department and the Green Mountain Care Board this year required additional reporting from the payers about their prior auth requirements, and we are aware of the payers adding PA requirements for a lot of services.
Yeah.
On the other side of that coin, we're also aware now that they've removed prior auth requirements from a lot of services. So, for example, Blue Cross Blue Shield of Vermont has removed all prior auth requirements for inpatient mental health services, and MVP has removed prior auth requirements for a number of prescription drugs, citing fairly high approval rates. So we're continuing to look at that issue, and we're currently in the middle of drafting a report to the legislature about opportunities to reform the prior auth process in Vermont.
Thank you for that.
Okay, any other questions?
Nope.
Well, if anyone thinks of anything, I'm always available by phone or email. I can be reached by phone at 802-828-4846, or I can be reached by email at Sebastian, Sebastian, .arduengo, ARDUENGO, @vermont.gov. We'll be accepting public comment from now until November 1st. And again, we anticipate going live with the updated uniform prior auth form by January 1st of 2024. So that'll conclude our public hearing. I'm grateful for everyone's input, and especially grateful for the teams at DIVA, MVP, Blue Cross, and Cigna that all came together to give input on the form, and were able to work together to update this, since it had been several years since the last update. Thank you all very much, and have a good day.
You too. Thank you, Sebastian.
Thank
Thank
you.
you. Bye-bye.